So I would like to ask you, how is the burden of rheumatic heart fever and rheumatic heart disease in India?
Basically, the incidence is almost like to the tune of 2 per thousand. It varied from various study to study, but then on an average 2% per thousand, 2 per thousand is the average incidence. But recently of late there are some studies from Delhi, from All India Institute, and from this was quoted in World Heart Federation meeting at Dubai in 2012, that the incidence is much more than what we thought, almost like 10 times more than what we thought, especially with the advent of echocardiography as a diagnostic modality. Echocardiography is soon becoming a diagnostic criteria. So incidence has gone up to like some 20% or so, 20 per thousand. So the problem is colossal. Only thing is we are not able to, because these are generally poor people, they live in slum, they are in unhygienic condition and all, so they are not picked up so early. And many times the sore throat is ignored by their parents, and nobody is there to look after their sore throat, which is the first manifestation, that the beginning of the seedling of rheumatic heart disease, rheumatic fever.
Okay. So do you feel that the diagnosis of rheumatic fever can be done on the clinical ground, and we can prevent the future RHD?
Absolutely. Basically, diagnosis can be very well done by clinical grounds, supported by some minimal investigations. And every time you don't require a throat culture to isolate the organism in throat. I mean, if you clinically you are confident that what looks is a streptococcal infection of throat, I think one should go ahead with the antibiotic.
Right, sir.
Especially the penicillin.
Right, sir. So, sir, as far as the prevention of rheumatic heart disease is concerned, how is the role of antibiotic and what steps a physician should take?
I think the first step in prevention is mass education.
Right, sir.
Dr. Sahu, we must educate the mass on this issue, that sore throat can lead to a broken heart. This is my slogan.
Right, sir.
A sore throat can lead to a broken heart. But unfortunately, this broken heart is in poor people. So not much attention is being given. Like I was given to speak in Hall D, not Hall A. Hall A is meant for, and this was a debate.
Okay.
So, and apart from antibiotic like penicillin, improvement in unhygienic condition, the overall living condition of the person, so that immunity improves, and then overcrowding should be taken care of. And then of course penicillin is a very important antibiotic, and I think one sort of benzathine penicillin, which is costing about 12 rupees 85 paise,
right, sir,
will solve the problem forever. Imagine the cost of surgery, which is something like 2 lakh plus, replacement of valve. From there to basic penicillin can be other antibiotics are also important. Now Aarti Lalchandani is from Kanpur has done a study on azithromycin.
Okay.
I discussed with Madam Anita Saxena from All India Institute. She is a very talented lady with a lot of information on rheumatic heart disease, lot of input. Vijaya Lakshmi gave me a lot of input, and her statement was, Vijaya Lakshmi's statement was, nip the bud when in the very early stage.
Okay.
So that was very good, I think, slogan. And second slogan, I would like to give it to all the physicians, that a sore throat can give rise to a broken heart.
Okay. So, sir, would you like to recommend azithromycin as a drug for penicillin
No, I would not.
patients?
I would not. This was just a suggestion of Aarti Lalchandani from Kanpur, who was opposing me.
Okay.
But as on today, azithromycin is not recommended.
Right, sir.
We should work on this issue and try to find out is there need for feasibility or not. Right. So, being a convener of the Rheumatic Heart Disease Council of CSI, which I am there for 2017, I would like that these issues should be highlighted, more education should be done, more message should go to the society, and public, government, NGOs, everybody should combine together to take care of this menace of rheumatic heart disease.
Right, sir. Yes. So, what key message you would like to give to the physicians or practitioners so that we can prevent the rheumatic heart disease and thereby we can decrease the burden of rheumatic heart disease in India?
Very pertinent question, Dr. Sahu. The first thing would be to improve the socio-economic condition, hygienic condition, and then try to improve their nutrition. And whenever you have a sore throat, it should be picked up by paramedics,
Right, sir.
primary physicians, even the PHC doctors. And once you have a clinical suspicion of sore throat suggestive of rheumatic streptococcal infection, I believe penicillin or other antibiotic choices are there, should be given.
Okay. Thank you so much, sir, for your time and for your valuable inputs in prevention of the rheumatic heart diseases.
Thank you
so
Dr.
much.
Sahu. Thank you all. Basically, the incidence is almost like to the tune of 2 per 1,000. It varied from various studies, study to study, but then on an average